So what's new? Is Botox the only kid on the block? Well, the answer is no. Sure, we've used Dysport, we've used Xeomin, but they're very, very similar to Botox. So how about Jeuveau? There's all this attention now. Botox is a household name. It's in a class of medicines we call neuromodulators. And there are other neuromodulators. One is called Dysport, the other is called Xeomin. Newest kid on the block is called Jeuveau. These agents are wonderful if used properly. They can help treat lines and wrinkles. They can make us look more refreshed, more youthful. And in the right hands, they can actually slow down the signs of aging. So now with 4 agents to choose from, how does a patient know what's best to use for them? Well, it starts with a clinical exam. We look at a patient's anatomy, and then we look at their patterns of facial movement, and that helps us determine what's going to be best. There are subtle differences between these products. Though Botox is the most widely used, there are some advantages of Dysport in that it spreads a little bit more. Sometimes that's an advantage, and sometimes it's a disadvantage. In my experience, Botox tends to last a little bit longer, but Dysport kicks in a little faster. And the main advantage of Xeomin is that there's no protein in it. So if a person suspects they may be allergic to one of these components, which is very rare today, Xeomin is the treatment of choice. The newest kid on the block is called Jeuveau. Jeuveau is very similar to Botox. We mix it the same way and we inject it the same way. It has a very similar lifespan and it kicks in a similar amount of time after injection. So why is it different? Well, the honest truth is it's not very different, but it is being targeted to younger people. The demand for cosmetic injectable treatments in the general population is growing fairly rapidly. But if you take a look at the growth in the younger population, the millennials, Gen Xers, it's growing exponentially. And that's the group that the company behind Jeuveau is targeting. So though these agents do have some differences, what determines the ultimate outcome, how good that result is the eye of the practitioner, the person that's injecting it. Number one, we have to analyze a person's anatomy. Is the brow high? Is it low? Is it arched? When they smile, do they use their upper face? Do they use their lower face? Are their eyes round? Are their eyes oval? There's many different variables that determine how we inject these products. After having done hundreds of thousands of injections over the last 2 decades, I tell patients, it's not only what you do, but it's what you don't do. It's spotting a patient that's not a candidate, or it's avoiding certain areas where they're just not going to respond well. In the hands of an experienced injector, these results should be predictable, they should be dependable, they should be incredibly enjoyable. Patients light up when they notice the effects of these agents. They look more youthful, they look refreshed, but they still look like themselves. And the days of over-injecting, where patients had flat foreheads and low-set brows, hopefully they're gone. In the right hands, it just should be a home run all the time. In summary, these agents are wonderful, and in the right hands, they should produce a predictable and really incredible outcome, and something that should just make you smile when you take a look in the mirror.